and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Give
Put
a
that
little
down,
hint,
would
a little
you?
hint of what we're going to talk about today.
right.
We're going to talk about trigger finger
Carry
and
on,
trigger thumb.
carry on.
If you have it, you probably know it. Generally affects like the thumb or the ring finger or the ring finger or the middle finger.
Get your
I'm
fingers
sorry.
figured out.
Ring finger, middle finger, or thumb.
Okay,
Most common. Very common in older women.
okay.
As you get up into 40s and 60s, it tends to happen.
So what are the symptoms of a trigger finger?
First off, if it's very stiff and tender in the mornings, and you may actually, quite often, usually I see is a lump right here on the palm of the
Right where the
hand.
palm meets the finger. Okay.
And it pops and clicks, but the telltale sign is if it locks in place.
So when you close your hand, that's when it's going to go like a click?
It
It's gonna
it could be when you close. It could even be like you could close it fine, and then when you open it,
It doesn't want to open.
it doesn't want to open.
And then you get
Right.
past that point,
Yeah.
and it usually hurts to get past that point. Is
Right.
that correct?
It's not a fun thing.
Okay.
So we actually have a video on that too, on different ways to treat it. But this BraceAbility, and I'll put the name down here, and I'll put their link down below.
Sure.
They're a place that sells braces, and a lot of nice braces.
Yep.
And they sent us one of these, and they say she sent us 3 of these, and we used them on patients.
Sure.
And they really liked them.
The patients did.
Patients really
Okay.
like them. What they like about it is that, one, it's one size fits all, because normally a brace like this you have to have fitted, believe it or not. And in fact, we had a lady who had a brace that was fitted for her, and she lost it.
So it's a custom brace?
Yep, it's
Okay.
a custom brace. And so we gave her one of these, and she ends up finding the other brace while she's wearing this one, and she still prefers this one.
Over the custom one.
Over the
Okay.
custom one. So
Sure.
she's still wearing it. So I thought it was a good testimony to
Right.
that.
So what does that do, Bob? Or
Well,
what-
the thing is, it stops you from bending the finger all the way.
So the first 2 joints can bend,
Right.
but the one closest to the palm is the one that has the problem, and that's the one that stays still. So you
That's
don't.
exactly right. So one of the problems with braces quite often is if they brace the whole finger, you can't move it at all, which is
Right.
not good. I mean,
Right.
you want to have some movement. So it kind of gives a solution here because it gives you some movement, but it doesn't give you the movement that's going to cause it to lock up.
And that's the painful part.
Right.
Right.
Unfortunately, this is not going to make your pain go away, make your problem go away.
Right.
It's likely still going to be there. I know there's injections you can do, and there's surgery, and a lot of people, even after all that, it can come back.
Sure.
So my only suggestion about this, and we're going to show you how to put this on in just a minute, but my only suggestion for this would be to make it like a tan color.
We're talking to the
Yeah,
manufacturer.
we're talking manufacturer. That way it wouldn't be so noticeable.
Right.
Because it is quite,
Right.
most people are going to talk. Looks like a ring this way, but
Sure.
the other way it looks.
Kind of a weird ring, though, Bob.
Yeah, I don't have it all the way.
We're going to show them how to put it on?
Yeah, let's do that right now. We'll cut away. All right, we're going to start off with, you're going to take the brace and you're going to put it, you're going to have your palm up here like this just to see where you're putting it here. And it's going to be below, that knuckle right here. You're going to put it right below the ring where you
All right, where the joint is.
yeah, where the joint is. There, so you're going to put it like that, flat, and you're going to pull up the one side, pull up the other side. It's a little clumsy. And then you're going to go ahead and tighten it up.
Good old Velcro, huh, Bob?
Velcro, it's this, and there you go. And once it's on, you can tighten it up a little bit more yet. And there you go, it's all ready to go.
Excellent.
So, thanks a lot to BraceAbility.
Well, you bet. Nice brace.
All right.